Welcome to On the Issues with ABC News senior White House correspondent Martha Raddatz and the Brookings experts for a dialogue on policy ideas. Medicare costs are growing. Senior fellow Alice Rivlin says our next president must control the costs and maintain the program.
You point out that conventional strategies to slow federal health spending, like cutting Medicare and Medicaid benefits or restricting eligibility, will just shift the financial burden to other payers, and the ranks of the uninsured will actually rise. Explain that first.
Yes, I think that's a hard thing for people to get. Medicare is the biggest federal program of health care. It's rising, its cost is rising rapidly, and people think, well, just cut it back. But the problem is that Medicare pays for specific problems. It pays when you get sick, and when you get into the hospital or go to see your doctor, you're not going to be treated differently than other people are treated with different kinds of insurance. So Medicare's costs rise partly because there are more older people, but mostly because the cost of any particular treatment or episode rises. And that's what we have to focus on. It's really a national problem, not a Medicare or a Medicaid problem.
So what do you do about there's I know you say there's no silver bullet here. There's nothing magic. There's no one solution.
No, there isn't. And unfortunately, there are a lot of people who think there is some one solution.
Not in healthcare.
They say, oh, just get electronic records. That's a good idea. We should have more electronic records, and that's one of the things we suggest. But it's definitely not a magic bullet, because unless the way people practice medicine is changed by the fact that they have more information more readily available, the electronic record is just a nice thing to have, but it won't change the costs. And similarly, people say, well, if we just paid for performance, paid for the outcome of the operation, not the fact that it happened, that would solve everything. Well, perhaps it would, but we're a long way from being able to do that. So there are lots of magic bullets out there. We ought to fire all of them, because we have a really big problem facing us of healthcare costs rising more rapidly than any other kind of spending.
So what would you advise the next president to do, particularly in regards with federal programs? What do you do? What's in your chamber there?
I would advise the next president and the next Congress to look at all the options are available for slowing costs and do almost everything. One thing is pay for performance. It is using the federal leadership in Medicare and Medicaid to design systems so that doctors and hospitals are rewarded for good performance and not just for seeing a patient. And that's going to be difficult. It's going to involve collecting a lot more information about what works and what doesn't, and using it to formulate good practice guidelines, and then fixing the pricing system so that we're actually rewarding those who follow the guidelines. That's not an instant solution, but it will help.
And you want to make it easy.
Well, you want to make it easy, but you also want to make it accurate. Some treatments work for some patients and not others, so a very general guideline isn't going to do it. We're going to have to work at things that work for particular groups of patients, define what those are, make sure that the information is out there.
Thanks very much. Great advice.